Hello everyone, migraine. Today's topic is about migraine. Migraine is one of the most common type of headache. By the way, for those of you who do not know me, my name is Dr. Muhammad Nasir Jawlar. Without further ado, let's jump right into migraine types. In general, we have 5 types of migraine, but today we're going to focus only on 3 of them. The first one is common migraine, or it's also called migraine without aura. The second one is called classic migraine, also known as migraine with aura. The third one is called complicated migraine. Okay, let's talk about the common migraine without aura. It says 5 or more than 5 attacks fulfilling each of the following criteria. It means not only the attack number, but each time that it happens, it has to last around 4 to 72 hours. Along with that, each attack should have 2 of the following characteristics. Unilateral, the headache should be unilateral, pulsatile, moderate to severe. It means severe enough to interfere with the daily activity and could be aggravated by routine physical activity. On top of that, when the attack happens, it should have one of the following signs and symptoms. For example, nausea, vomiting, photophobia, phonophobia, osmophobia. Last but not least, it should not meet the criteria for other types of headache. Just to summarize, since today we're going to focus more on common migraine without aura, when common migraine or migraine without aura, when it happens, it's not only about the numbers, but each time that it happens, it has to last between 4 to 72 hours. Along with that, when the headache happens, it should have 2 of the following characteristics. Like the headache should be unilateral, pulsatile, moderate to severe that interferes with daily activity, aggravated by routine physical activity. On top of that, when the headache starts, it should have one of the following symptoms like nausea, vomiting, photophobia, phonophobia, osmophobia. Okay, let's talk about the classic. Fully reversible aura symptom that precedes headache. It means the aura happens and then after aura, headache happens. What is aura? Like flashing lights sensation, pins and needles sensation, like paresthesia sensation, loss of vision, dysarthria. These feelings happens and they may last less than 60 minutes. And after that happens what? The headache. So aura, depolarizing wave of cortical spreading depression across the cerebral cortex that may cause an aura. Example, like visual symptom due to wave through occipital cortex and activate trigeminal nerve afferent fibers. When it comes to complicated migraine, it is severe persistent sensory motor dysfunction or deficit, like hemiplegia, and so on. No, as I mentioned before, we have 5 types. Another type of migraine is called status migrainosus, a single attack that's lasting more than 72 hours. A cephalgic migraine, aura without headache, just the aura, no headache. It means all the aura that I mentioned before, flashing light, pains, needles, sensation, loss of vision, dysarthria, but there's no headache. Okay, let's talk about the migraine epidemiology. It affects 18% of the females, 6% of male. Frequency decreases with age, especially at menopause, mostly at younger age, 10 to 30. So it means male are affected less than female. Female are affected around 18%, but male are affected around 6%. In terms of etiology, there's a possible association with vasodilation and vasoconstriction. Vasoconstriction, vasodilation in the brain structure. Significant genetic contribution could be an etiology. Triggers are stress, sleep, excess or excessive sleep or deprivation of sleep, drugs like estrogen and progesterone, and nitroglycerin, hormonal changes, caffeine withdrawal, chocolate intake, vitamins intake, like red wine, cheese, and stuff like that, nitrates, as I mentioned before, processed meat. So these could be triggers and causes. Okay, let's talk about treatment of migraine. We have two types of treatment. One is called abortive treatment, and the second one is called prophylactic treatment. In abortive treatment, I made a mnemonic that's called NEAT. NEAT is not a word, it is a mnemonic that's made by me. N stands for non-steroidal anti-inflammatory drug. Also acetaminophen, you can give acetaminophen as well. Ergotamine, E stands for ergotamine. A stands for antiemetic. T stands for triptans. For prophylactic treatment, also I came up with the mnemonic which is ABC. A stands for anticonvulsant, like topiramate, valproate. Another A stands for antidepressant, tricyclic antidepressant, and venlafaxine. B stands for beta blocker, propranolol, and metoprolol. By the way, this is the best prophylactic treatment, beta blocker. Calcium channel blocker, verapamil. Note, there's another type of migraine that's called by medication overuse. Use of triptans, opioids, or combination of analgesic or these two for 10 or more than 10 days, or only non-steroid use for 15 or more than 15 days per month can lead to medication overuse headache, or it is called rebound headache. Thank you very much for watching this informative and educational video, which is prepared and posted by me, Dr. Muhammad Nasir Jala. I am the president and CEO of Jala Academy. I have provided all these videos from very reliable sources like Toronto Notes and UWorld. Toronto Notes is a Canadian resource, and UWorld, UCMLA's US